Okay, now it's recording. Um,
Great.
for those of you who don't know me, so my name is Dr. Gareth, and I am a chiropractor operating out of Fusion Chiropractic up in Whangaparoa. And basically, I became a chiropractor out of, it was a little bit of an accident. But what I had no idea was that a lot of the health concerns and the issues that I had, everything with with fatigue and digestion and things like that, I had no idea that they could just be resolved naturally through chiropractic, through diet, through sleep. And anyway, so I'm super passionate to share um, the really natural and like sometimes obvious solutions that we don't necessarily think about so that we can make a difference with other people. Now, because I can't practice chiropractic in this lockdown, I was like, how can I make this time valuable and like how can I be helpful? And so I decided to get in contact with people like Kohei so we could actually provide some information that would make a difference for people at home. And like I know Kohei through, like I work with him. I send all my clients to him as the expert in naturopathy. But this particular topic, eczema, was like his help because my little girl had eczema and she had it for a long time, and it was really frustrating for me because I know a lot about health, and it was really perplexing for me that my daughter had eczema. So I took her to Kohei, and he did a couple of things and started us on the path to resolving it for her. And she doesn't have it anymore and hasn't had it for about a year now. So anyway, I'll let Kohei introduce himself, and we'll get started.
Cool. Thanks, Gareth. Yeah, so my name is Kohei Gucci, and yeah, I've been practicing as a qualified naturopath and medical herbalist for about 6 years now. And yeah, I suppose what started off my journey was actually getting eczema myself. So 2010, I was actually head to toe covered in eczema, to a point where I had to quit work. I was bedridden for about 4 months, 5 months around that time. I actually didn't really step outside because everything just hurt, you know. I was weeping from everywhere. It hurt to even smile. Taking a shower was just absolute agony. Um, and so at that point, I had tried a lot of different, um, I suppose, conventional medicine approaches, which is it's a go-to for most people. And I was giving steroid creams, steroid pills, antibiotics, all sorts, and it just wasn't doing anything, and it was actually making things worse. So at that point, I was introduced to a naturopath, and that was the first time that somebody had actually sat down with me for 90 minutes. You usually only get about 10-15 minutes with a doctor, even a specialist, for that matter. And for somebody to sit through 90 minutes to actually hear what I had to say and discover what was actually going on within my body, rather than saying, hey, eczema is not curable. Here's the things to stop the itch. Um, the naturopath actually took me through everything and then told me that, these are the things that we need to do to fix the root cause of your issue. And that really just made sense to me, and it prompted me to sort of get into this industry and start studying straight away, because it just made sense, and I could become real passionate about it. So that started off my journey, and so here I am, and I do specialize in skin health now. So I do get a lot of patients from New Zealand as well as overseas coming in to see me, and I see some of my overseas patients on here as well, which is great to see. Um, so yeah, it was so nice to hear from Gareth because you know, he has been sending me quite a few patients, which has been amazing. And when he reached out to me and said, "Hey, we should do something while, you know, we're in lockdown, we can't really see um, patients. Um, let's do something for the community and let's give back and just give you guys some information that might be helpful for you guys." So, and we will be focused on eczema today. And like I said, when I visited the naturopath, he told me the things that I needed to do and to discover the root cause of the issue. And that's what I wanted to talk to you guys about today, is sort of discovering the root cause. And so, yeah, but just one thing before we get all straight into it, just a little disclaimer, I suppose, that this webinar is for educational purposes only. And we're not trying to diagnose or treat any medical conditions, illnesses, or diseases. We have to be very clear about that. So just letting you guys know that it's just a bit of information that I hope you guys find useful.
Great. Awesome. Cool. They're very exciting. All right. So the first question I have for you, Kohei, is what is eczema? Like, what is it actually?
Yeah, so that's actually a very simple question to answer, but very hard to explain. And what I mean by that is that eczema is such a broad term. And so it basically means, when you look it up on the internet or anywhere else, it'll describe eczema as inflamed, red, itchy skin. And that's great, but it doesn't really narrow things down. There's so many skin conditions that can come under that umbrella of itchy, inflamed, red skin, you know. And even within eczema, you know, you have usually eczema equals atopic dermatitis, which is an allergy-based condition, right? But it can be changed. Some of these terms, different terms for eczema, atopic dermatitis, anything like that can be interchangeably used. Um, and like I said, it's such a broad term that it covers a lot of different conditions. Um, so when we talk about eczema, there are also different categories of eczema as well. So you have things like atopic dermatitis, you have things like seborrheic dermatitis, you have discoid eczema, you have contact dermatitis, you have dyshydrotic eczema, and then you also get things like TSW, which is topical steroid withdrawal symptoms, and that's, you know, basically a consequence of using steroids for too long. Um, and yeah, it comes out as eczema, which is relatively difficult to treat. And when I say difficult to treat, I mean it takes a long time to heal. So, you know, those, when you look at those different categories of eczema, you're already looking at different treatments for those things. You're looking at, you know, if it's atopic dermatitis, all right, what's the allergy? Let's calm down the immune system. What is this person allergic to? Let's find that out. When it's things like dyshydrotic eczema, that can be things like stress, sleeplessness, intolerances, and TSW, obviously, it's a matter of controlling that inflamed skin as a consequence of not having that steroid to rely on. So all of those things require different treatments. And then we also look at, I suppose, different outcomes of eczema or concurrent issues, and that's things like infections. So when you have eczema, you itch your skin, the skin is broken and it's compromised, and it's susceptible to infections, especially things like staphylococcal infection. Um, and so when you're treating it, you can't go, oh, that's eczema, let's bring down the allergy. No, you have to treat the infection first before you can do anything else. So that makes it a little bit different. And there are also fungal infections as well, like ringworm, and other sort of parasitic type of infections can also present looking like eczema. Um, so there are a few different infections that can mimic eczema. And then it might not also be eczema at all. So it can be things like psoriasis or urticaria, shingles, pityriasis rosea, which is a type of usually caused by viral infections. Those are all very different conditions that would require entirely different treatments, but it can somewhat look like eczema, and if you treat it like eczema, then it's not going to go away. So that is sort of like the extended explanation of what is eczema. All those things that I noted are not eczema, but often classified or wrongly diagnosed as eczema. So that's something that you do have to be a bit careful with. And, you know, we do have quite a high prevalence of eczema in New Zealand. And that is more specifically atopic dermatitis. We have about 20% of our population presents with atopic dermatitis. And amongst other countries, we're actually quite high on the list. That's 1 in 5 people. So that means that, you know, I mean, obviously, people that are on here right now, you guys probably have eczema or some type of skin condition, or you know somebody else that does, right? And that's because it's so prevalent over here in New Zealand. Um, and the reason could be due to things like pollen or dust mites. I mean, we are living in the subtropical rainforest kind of climate. It's very damp. Our housing isn't great. So you get a lot of things like dust mites, especially if you have carpets. Um, Pollen, there's a lot of pollen over here. And a lot of people are allergic to those things. So yeah, there's so much here, and yet you might be finding it difficult to treat because um, it may not be specifically atopic dermatitis. It could be something else, or it could be happening at the same time. You could have atopic dermatitis and something else. And so that again requires different type of treatment. So you can see that, yeah, if you don't have the right treatment, then you're not going to fix the issue.
Wow, this is fascinating, guy. I'm already got like questions for myself popping up. Just and all you've done is answered what is eczema.
Yeah.
Okay. This is good. So I'm not going to ask them again. I suspect you're probably going to cover them in the next couple of questions. But wow, okay,
Yeah.
this is fascinating. All right, all right. So now we have at least a baseline for like what is it.
Mm.
Um, what are the current issues in actually treating eczema?
Mm. Okay. So yeah, there's a few different problems at the moment, and one is, you know, what I talked about is uh, not finding that root cause. Now, so the first problem is first point of contact for a lot of people is you know, going to the doctors, and let me make this clear that there's nothing wrong with going to the doctors. I am not anti-doctors. I'm not anti-medical system whatsoever. We all have our place as health practitioners, depending whether you might be a naturopath or a doctor or a nurse or a chiropractor or a physiotherapist. We all have our place. Um, and but unfortunately, the in the Western medical system, things like eczema, it's not urgent, or it's not scary for um, most people. It's just something that's annoying. Um, and so in that sense, there's no sense of urgency to treat it. And probably the main thing that they want to do is treat the symptom, which is the itch, which, the medical system does a really great job of by using things like steroid creams. Like, you use a steroid cream, most of the time the itch is going to go away. However, it's only a temporary relief. Um, so in that sense, it in their medical field, eczema is deemed not curable. That's the main issue there. So there's not a lot of, I suppose, research being done, not a lot of effort being put into place to say, yes, let's treat the root cause. And like I said previously, when you go to the doctors, you only get about 15 minutes, and within that time, it's very, very difficult to determine what might be a root cause. Very difficult. Um, you know, I spend 90 minutes on the initial consultation, and the follow-ups can be anywhere from half an hour to an hour. And yes, sometimes I can find the cause in the first consultation, and it's very straightforward. Sometimes it takes 3 months, 6 months to go, aha, this is the cause, because we needed to delve into it further and further and further and dig out what is actually causing it. So I think at the moment, one of the big issues is that yes, we do go to the doctors. We don't get enough of that thorough consultation to determine what is the issue. And because there's no other um, way of treating it besides things like steroid creams, antibiotics, and other anti-inflammatories, we kind of get into this bit of a vicious cycle of using these products, using these medications, because, like I said previously, it is a temporary relief usually. Which means that when you stop using it, the body comes exactly back to where it was, or even worse sometimes. And we get into the cycle of having to use stronger and stronger and stronger creams and pills until it gets to that point where it doesn't do anything. And that's where I ended up, and that's definitely not where I want any of my patients to end up either. Um, so it is, it's just one of those things where you really need to dig down and find out what the root cause is. Um, Now, with, oh yeah, and this is why you might also find yourself afterwards, you go, okay, medical system isn't quite working for me. What do I do? Most people will reach for their laptops and their phones and start typing into Google. And this is where we sort of run into our second problem, is that there's a lot of information out there. And also the information that you find out there are typically just solutions. And those solutions are usually quite generic, or it's some YouTube blogger who has eczema or who had eczema and did something and it worked for them, which is all fantastic. It's great to be able to share that, and I'm sure it helps, some people for sure. Um, but it's not specific to you, and that is the issue. Um, there is no winning formula to treating things like eczema. There is no miracle cream. There are no diets that works for everybody that has um, eczema. I wish it did. Then it makes things a lot more simple for me. Um, but there isn't. Um, there, what exists is you, and you as a unique person. So um, it's your diet, it's your lifestyle, it's your genes, it's your experiences, your habits, your environment that you live in. It's all very unique, and the information that's out there is not um, it's not directly a solution for you. Um, and so that's why you might end up spending a lot of time and money on creams and diets and all sorts, but you don't get to see the results that you want. And this is why we need to ask the right questions, I suppose. The right questions that you want to ask yourself to really start finding out what the root cause is.
Yeah, it's quite good. I quite I like that, Kohei. And I think probably if I was going to emphasize some, because I'm really big on the headspace side of health and well-being, is if I was going to emphasize something you said earlier in this question, is getting that um, like eczema is not incurable. Like
Mm.
your body is actually designed to be healthy. It's not designed to have eczema. Um, but if you're asking yourself the wrong questions and you're looking in the wrong places and you're trying the wrong things, then you may not. And if you're trying, especially if you're trying to use something that should work for everybody,
Mm.
uh, then that's not going to be helpful. So,
Yeah, look, I mean, I get a little bit hesitant to use things like the word cure, because often when you say that, a lot of people will interpret it as, you treat it and it never comes back again.
yeah,
And in that sense, it is true what the medical system says, that it is not curable. However, you can bring it to control so that it doesn't affect the quality of your life. And that's what I've learned through my experience, is that, every now and then I still get a little bit of eczema on my fingers. They're great at the moment. But when I'm not looking after myself properly, and yes, naturopaths sometimes do derail and we don't look after ourselves. It does happen. But when that happens, it comes back a little bit. But what's great about it is that it's not all over my body anymore. And when it does come back, it actually works as a little reminder to say, hey, you're not looking after yourself properly. You need to look into what's causing the issue. And um, and then it's great. It's a great way to look after yourself and go, okay, it's the body's trying to tell me something. So it's a matter of bringing it back into control, so you have control over it, not it having control over you.
great, great.
Yeah.
Okay, so well, the next question then is, what are the right questions like um,
Mm.
that are important to ask?
Yeah. So it's interesting because it's often the questions that we would ask for everything else in life, but we sometimes don't ask it ourselves. Or sometimes it is a bit more complicated. But so let's say you had a plant, right? A house plant. And let's say that it wasn't doing so well. Maybe it has a little bit of fungal growth, or the leaves are starting to go brown, or whatever it might be, you look at that plant and what would you like? What would you ask yourself at that point, or what would you do? And don't say, I'll throw the plant out. And I know some of you are thinking that, but you can't
Everybody
do
loves saying that, eh?
that.
I'll throw the plant out.
Yeah, which is a quick solution, but then you have to get a new plant, and you can't do that with your body. So um, the questions that you would ask to that, well, not to the plant, but to yourself to help the plant is go, okay, what might be causing that, right? That would be the first question. Then you start to look into the finer details and go, okay, what what are the ideal conditions for this plant? You know, where is it supposed to be in direct sunlight? Is it not? Um, am I supposed to water it every day or not? Am I supposed to change the soil? Like, what kind of soil does it need? Um, these are all the questions that we would ask to figure out what's wrong with the plant. And that's exactly what we should do with our own health. But quite often, what we tend to do is we sometimes skip that process and go, okay, here's the issue, and the presenting issues, and I'm going to find the solution. Um, so we skip that process and we just try to find that solution right away. And especially, you know, if the eczema is very irritating, you want to find that solution straight away, and you want something desperately to reduce that itch. And I can understand that. But if we don't go through that process, then we're not going to treat it properly, and it's not probably not going to go away properly. So it does, yeah, and then we use this sort of plant analogy in natural medicine quite a bit. We actually think of a tree, actually, the tree of life. So you see the leaves as sort of like the symptoms, and yes, you have the option to cut those leaves off and just get rid of the symptoms, but then need to look at the branches, the trunk of the tree, which is your body, the roots, which is your gut, and the soil, which is your environment. You know, we need to look at the whole. Um, we need to look at the whole tree to figure out what is going wrong um, with that tree. So it requires quite a bit of detective work. And I suppose within this next little while, I'm going to sort of discuss with you guys some of the questions you need to ask so that you can figure out your triggers and your causes of the eczema that you might have.
Yeah, that's good, because that was exactly the question that was like, if I'm thinking about a plant and I look at the leaves and I'm like, what's missing? What does it need? Water? Does it need sunlight? What does it need? So what kind of you'd ask those questions of a plant, but what kind of questions would I ask of myself if I had eczema?
Yes. So, first question, and that's a very important question, is when did it start? So, and this is usually the first question that I ask my patients. So I'm giving you guys all the questions that I usually ask in my consultation. And this is what makes this webinar a little bit different from some of the other things that you guys might have seen already is, you know, we talk about eczema and there's the solution. No, let's talk about the questions that we need to ask ourselves. And the first one to start with is, you know, when did it start? So did it start when you were in your 20s? Or did it start when you were younger with did it start right away when you were born? And this is something that you can ask your mom because she was there. I guarantee it. And yeah, I often get my patients to call up their mom in the consultation to say, hey, like, did I have eczema right from birth? Because that is important. Um, Usually, if there is eczema right from the beginning, then there's usually a family history. So that's another thing to ask as well. So does your mom have it? Does your dad have it? Do your siblings have it? How about your grandparents? And the more people you have around you that had the similar issues to you, might have more answers, and you can actually ask them about their experience and what they had done to treat it. So that's very important. So talk to the people around you. Um, was it after a certain event? So if it did happen in your 20s, did you go on an OE, or did you go to the UK and just party like crazy and, take all sorts of alcohol and drugs and party all night? And, that's bound to cause some issues with your health. So, it's looking at that and going, okay, so if that is the issue, then perhaps it might not be allergy. It could be something more related to your gut and your liver. And just coming back to my experience, that was actually my issue. I had appendicitis when I was 14, and I nearly died from it. And I got a lot of antibiotics to, clean everything up because it had already burst inside. And it was from there. I had a little bit of eczema, atopic dermatitis when I was younger, but it was never bothersome. But after that, the antibiotics just sort of killed off a lot of my good bacteria in the gut. It started to deteriorate. That put a lot of strain on my liver to clear out all the toxins that my gut was leaking into the bloodstream, and it just became a very toxic environment inside my body. And so my body was trying to push out toxins through my skin. And that was my issue. It wasn't really the allergies. So what we did as a treatment is to start cleaning the blood, cleaning the liver, and make sure that my gut was sealed up properly and it was functioning properly. And it took about a year for me to get to this point, but it worked. And that was what I needed. It was a bit more of an adult onset dermatitis. So again, different treatment. Um, was it after a vaccination? And this is a very controversial topic for everybody, I suppose, at this point. Um, but what I have seen um, is that clinically, in terms of research, um, vaccination doesn't really cause eczema to come through. There's no causation. There are some correlation studies to suggest perhaps maybe some forms of vaccines, and after that, there might be a higher chance of you getting allergies. But so far, there's no statistical evidence to prove that there is. However, in my clinical experience, I have seen a lot of patients who started to develop allergy issue even within a week's time after vaccination. So there seems to be a bit of a correlation there, but yeah, that's something to also consider. Or did it happen after some type of trauma? So a major stress event in your life. I did meet one young man who came in, and we went through the consultation, and we thought it had a lot to do with food and things like that, which there were some components there, but it turned out that it was a lot of the trauma that he was holding on to, and that was causing a stress response. So once we started dealing with that, it started to go. So it's looking at when it started and what happened around that time is what you want to ask for yourself, and that is the first question. Whew, I'm a
Well,
bit.
sometimes, and just something to add there, Kai, sometimes it's a
Yes.
couple of different things. So it may be that you got a course of antibiotics, then you had a vaccine, and especially if you're like a child, let's say your parents were super stressed out, like you can have a few different events over a short
Yes.
period of time or even long period of time, and there'll be one final thing that triggers off the
Yeah.
whole lot. Yeah.
Yeah. And so, yeah, what you want to do is, if you haven't gone through these steps, write these things down. Don't just think it in your head, just write it down. Okay, when did it start? 1995. Okay. What happened around that time? Ooh, I remember this happened. So just start thinking about those things that might have triggered it or when it started. Um, and I suppose it's also asking, how did it start? Where did it start in the body? You know, so asking yourself, or yeah, you might have found that it started in your elbow creases. Um, it might have started around your face. It might have started in your torso. All those things can indicate potential sort of different types of eczema, because places like elbow folds, behind the knees, those are very typical of atopic dermatitis. But around the face, it could be things like seborrheic dermatitis. When you're a baby, you might have had cradle cap. Those things can relate back to more of a bit of fungal overgrowth. Um, were you a C-section baby? That's another thing that you also want to ask, because that can affect the way your gut functions. You have uh, reduced variation in your good bacteria or beneficial bacteria when you're a C-section baby, or when you're more likely to have that, because you're actually not exposed to the probiotics that your mother has when you go through the vaginal canal. So that's something to also take into consideration, because gut health is also very, very important for controlling your skin conditions. Um, and it's also about asking how it looks now. It may be the same since when it started, or it may have evolved, and that could be due to the worsening of the issue, or it could be a change in the cause of your issue. So you might have started off with a bit of atopic dermatitis like me, but it was changed by something else, by other events that you might have come across. So that's also important. The presentation of the skin right now is also very unique to specific dermatitis, so that again will narrow it down for you in terms of what kind of eczema you might have. Um, and then looking at potential patterns as well. And this is very, very important. So is it consistently there? Is it the same amount of itch all the way through day and night? Or is there a bit of up and down between day and night? Quite often, nighttime is much worse for people, because your body might heat up a bit. There's nothing else to focus on, so the itch comes through in your mind much more strongly, and um, and also at nighttime your cortisol levels drop, and cortisol is something that it's an anti-inflammatory hormone. So if that drops, then you could feel a lot more itchy. um, does it come through monthly, or does it come through in seasonal patterns? Those are again key sort of cues or information that will give you an idea of why it might flare up at those points. Recently had a patient who sort of a wee baby, and yeah, tends to flare up every month or so. Um, and it turned out to be a bit of parasitic infection. Parasites tend to have that monthly cycle. So yeah, we investigated that, and yeah, doing much better after parasitic treatment. Um, what else? What makes it worse? So this you probably would have asked yourself already, but is it the heat? Is it certain types of food? And if it is, really start to take notice of those foods and go, okay, is it that? And do a bit of trial. And I'll explain a little bit about that in the next section. But it's really narrowing down the things that make it worse for you. It might even be stress. Things like urticaria, again, can look like eczema. But for a lot of people, um, it could be what's called urticaria, which is a lot more mysterious than eczema. It comes through, it's like hives. Well, it is hives. And it comes on randomly and it goes away randomly. But quite often it is related to stress. And again, a patient that I'm treating right now has a bit of urticaria on her neck, but it comes and goes. And we figured out, we saw a pattern every time she had a stressful event. Um, she was feeling she wasn't getting sorry, she was getting those flare-ups coming through. Whereas, now that her very stressful manager has quit her job and has disappeared somewhere, it's less prominent and it doesn't come through as much. So that again is very interesting, the way stress plays on your skin. Um, the other opposite question you want to ask is, what makes it better? So what are the things that you might do that you've realized that, oh yeah, this calms my skin a little bit. This feels good. That can be another piece of information. Um, One, it could be things like, a bit of cold therapy, so just putting on something that's cold, and it tends to bring down the heat and the itch, which, for most people it works. Um, Moisturization, does it feel better after moisturization or does it feel worse after moisturization? One thing that I can note is that, like I said before, there is no cure or miracle cream that works on everybody. And hence why I don't have creams that I work with. I try and find the most suitable topical application for that person each time. Um, Most often, people are on things like emulsifying creams or sorbolene. Those are classic ones that people use, but they do contain petroleum and paraffin, which means that it traps the moisturization in your skin. Now, that can feel quite nice, keeping it moisturized, and it does a very good job of doing that, but it doesn't let your skin breathe. And quite often, if you apply that at nighttime after you take a shower and you go to sleep, it'll trap the heat in, and that will worsen the itch at nighttime. So, yeah, figuring out what kind of creams work for you best is very important, and it's through asking the right questions. Um, Another favorite question I like to ask is, when you go on holiday or when you go somewhere else, when you leave the country or yeah, you leave your home, does it get better or does it get worse? And this gives a huge advantage of figuring out whether there's environmental issues. So, a lot of the times people go on holiday and their skin clears up out of nowhere, and it only takes about a week. Um, and you can tell straight away that it's not really the food, because usually when you're on holiday, food sucks. Like, you have the worst food because you're walking around and you're enjoying all the cuisine in those local areas that it's not often home cooked, and you're trying different things. So it's usually the change in environment that has brought about that improvement. So when you think about that, then you can measure how much improvement you've had and then figure out how much of that environment has affected your skin. So that's another favorite question I like to ask my patients. And then the last little question you might want to ask is, do you have any other health issues? So do you have any gut issues? Do you have any other fungal issues like athlete's foot or thrush? Do you have asthma or hay fever? If you do, then quite often your family members will have it, which means that you'll have that family history, which means that there's some type of allergy going on, right? Do you have poor immune system? Do you get sick all the time? Do you get colds and flus a few times a year and you find it difficult each time for you to recover? Those kind of things can also affect your skin, and you might be more vulnerable to things like staph infections. So that's also very important. Do you have any other chronic issues like diabetes or heart disease? You might be taking some medications that may also cause skin issues. So look into your medications if you are taking some, and see if your skin issues started around the time that those medications were started. Um, and who knows, like you could even talk to your doctor and say, hey, I'm a little bit suspicious about this. Am I able to come off it or wean off it? Do not, and I repeat, do not take yourself off medications yourself. Always talk to the doctor. And if you have the chance, talk to your natural health practitioner, so that you can all work as a team, and try and figure out a way of figuring out whether it is that medication that's causing the issue, or um, or yeah, and also being able to wean off that and figuring out the process of doing that. So I suppose those are all the questions that you could ask yourselves, and write it down, and try and figure it out. Um, because quite often, if you ask the right questions, you'll get somewhere. You'll definitely get somewhere. So really note those kinds of questions down. If you have some more, great. But yeah, those are the questions that I would definitely get started with.
Great, great. Now I'm just a little bit conscious of time. So what I'm going to say is, if anybody has a specific question, pop them in the chat box, and because I've got one more question for Kohei, and then we'll either answer some questions, or he's got some cases that he can and examples he can go through. But
Mm,
yeah, so if you have a question right now, pop them in the chat box, and after I've asked him my last question, we'll go through those. So
mm,
uh, yeah, so the last question that I have then is, what are the things that like I can do, like
yeah.
so I've already asked some questions. What are like
Mm,
things I can do after that?
yeah. So you want to look at some testings. So things that you can do are like IgE food panel. IgE is a type of antibody test, which detects your allergies to certain foods. And this you can usually get done through doctors or functional testing, which is a great way to figure out your allergies. Skin prick test you might have already had done. It's one of the go-tos for doctors to figure out your allergies. However, just remember that it's not the most accurate test. Um, it has been said that it has about 50% false positives, which is not a good percentage. So, and especially for things like foods. So if you don't know what this test is, basically they prick you with these allergens on your skin and see what kind of, if you get any welts coming through or if you get any reactions coming through. Um, Great for things like environmental things, I suppose, but with food, food is a bit different. When you put food through your skin, it goes directly into your bloodstream, whereas when you put through food through your mouth and through your digestive system, um, it's a different story. The chemical processes within your gut will change and denature proteins and fats and things like that. So In terms of food testing, I would probably go with things like IgE testing, which is going to be much more um, comprehensive for you. You can also do things like IgG. So this is the same type of antibodies, but this is looking at intolerances rather than allergies. Allergies are very quick and strong reactions of your immune system, whereas intolerances are much more mild and quite often comes out as different sort of symptoms. It can even be tiredness, just feeling a little bit low, feeling a bit of bloating or gassiness. Those are the symptoms that you might experience after having an intolerance response. And that could even take about up to about 48 hours before the symptom shows up after you have that intolerant substance. So that's also another good thing to look into, because it can certainly trigger or worsen your skin issues when there's these inflammatory responses are coming through in your digestive system. Um, Hair test is something that I do quite often, and that's something that I did for Gareth's daughter. And it's a simple procedure where we take the hair sample and we get the intolerance tested that way. It's much more cost effective and it's just easier to do because it doesn't require any blood draws or anything. So we can do it on kids and infants. Nice and easy as long as they have some hair. Um, Now, there are a lot of hair tests out there, and it has become a problem recently. And we have, as our naturopathic association in New Zealand, um, we have decided to really limit the uh, the different companies that provide these services, because we've had a look at some and they are terrible. Um, they come back with crazy foods that you probably haven't even been exposed to in your life. And it shows that you're intolerant to it. And it's like, well, how can you even tell that? You would have had to have some level of reaction for us to measure that. So do be very careful if you're gonna get some type of testing done. Get it through a practitioner, not on some random website, okay? Because you could be wasting a lot of money. So those are some of the tests you can do from the doctors or from the naturopaths and other natural health practitioners. Things that you can do at home are things like elimination diet. So really simplifying your diet and clearing out a lot of different potential reactive foods out of your diet, and then so you eliminate it for at least 3 to 4 weeks so that the antibodies can clear. And then once you're feeling relatively good, then that's when you start to reintroduce things one by one so that you know which food is reacting with you. It is a bit of a process, but it's the gold standard in figuring out your intolerances. So that's something that I would recommend. And along with that, you want to keep a good diary. So symptom diary is very important. Note down when you get these flare-ups and what you might have had to eat around that time, or what you've been exposed to, or whether there were some stresses around that time, anything that you can think of that might have contributed that was different from your daily routine. So that's also something that's very important to keep, that you can do at home, nice and easy. And then the last thing you can do is actually go and see a practitioner. So you can do all of these things and you can discover it for yourself. Absolutely, I would highly recommend it. But if you want to sort of shortcut the process, I suppose, then you can come and see a practitioner um, and sort of have that guidance and have the availability of those tests as well. So those are the things that you can take from today, is the questions that'll be your first start. then you can start to look at things that you can do and things that resonate with you to start treating your eczema.
Great.
Uh,
Uh, Thank you for your time, Kohei. It was really, I learned a couple of things there too, which is really cool. And if anyone isn't already a client of Kohei's and wants a consult, I would recommend it. He's like, I haven't had anybody come back and say that he didn't help them. So I can vouch. I can vouch for that. And thank you for everyone who being on here. It's really exciting to be able to share this information with you, especially with the current stress that we're all experiencing with
mm,
with the virus that's going around. So,
mm.
anything else you want to say, Kai, before we go?
Yeah, no. First of all, like thank you, Gareth, for creating this opportunity to do this webinar. And I think it'll be quite nice to keep doing something like this.
Mm,
So, let's keep in touch, and we'll let everybody know when there's another one coming up soon. Maybe give us some ideas of what we want to talk about. But yeah, it's been great. Thanks for everybody who turned up today. Hope it's been helpful. If there's further questions, just you know where to get in touch with me now. I'll be happy to help. So yeah, come in and just have a chat with me, and we'll figure things out from there. But hope everybody's keeping safe, keeping to their bubble, and yeah, hopefully this will all blow over not too long in the distant future.
yeah, for sure. Beautiful. All right. Thanks, everyone. We'll see you all soon again.
Yes, thanks for everybody.